Hi, I'm Dr. Kylie Fuller, a board-certified OBGYN, and today I'm back to talk about ultrasounds and prenatal testing, a gigantic topic. We're gonna go over what they are and why we use them during pregnancy. Ultrasounds and prenatal tests are a routine part of pregnancy, but they can definitely feel confusing and even a little overwhelming. So let's break it down. One of the first ultrasounds usually happens early in pregnancy, often around 7 or 8 weeks. This ultrasound helps us confirm the pregnancy, make sure it's in the uterus, and gives us your due date. Now remember, due date is not when the baby's going to come. It is just helping us track the baby's growth throughout the pregnancy. Early ultrasounds, however, are usually done transvaginally. It's common, it's safe, and needed due to the small size. Later in pregnancy, you will then have a formal and detailed anatomy ultrasound, usually done between 18 to 22 weeks. This will carefully look at the baby's growth, check major organs, and do a general head-to-toe fetal survey. After these initial ultrasounds, we check on your baby at your routine prenatal visits with something called a Doppler. While ultrasounds are generally safe and you get to see the baby, which is fun, ultrasounds still use targeted waves that can generate heat. And too much of anything is generally a bad thing. Now, the exception to this would be high-risk pregnancies, where the benefit of additional fetal monitoring outweighs the risk. Now, in addition to the ultrasounds, there are different prenatal screening tests that help assess the risk for certain genetic or chromosomal conditions for you and the baby. These are screening tests, meaning they give us information about risk. They do not give us a diagnosis on their own. The most common test we offer is called the NIPT, or non-invasive prenatal testing. This is a maternal blood test that looks for small fragments of the baby's DNA in the mother's bloodstream, and it can be done as early as 10 weeks. This test looks at the baby's chromosomes, specifically abnormalities in chromosomes 21, 13, and 18, as well as the sex chromosomes, but also so many more. Since we are evaluating the sex chromosomes, this test will generally give us the baby's gender as well. The other test that has now become routine to offer is carrier screening. Again, this is a maternal blood test that is checking to see if you carry genes for certain rare genetic conditions, even if you don't have the symptoms yourself. Some examples of these are cystic fibrosis, SMA, Fragile X, PKU, and again, many others. Being a carrier usually does not affect your health, but it can matter for your baby if both parents carry the same condition. Another really common question is whether prenatal testing is required. The answer is no. Most testing is optional. The goal is to give you information so you can make the choices that feel right for you and your pregnancy. It's also important to note that an abnormal result doesn't automatically mean something is wrong. Often it just means we need more information or closer monitoring, which we will discuss in future videos. Ultrasounds and prenatal tests are tools we use to support a healthy pregnancy, and your provider should always explain your options and your results clearly. If you're unsure about which tests are right for you, having the conversation with your OBGYN can make all the difference. So see you in the office.